Everyone, Sandy here again with Health Tracks at Home. Again, this week we're going to talk more about some of those COVID claims out there and things that we're being asked to do, and hopefully give you some basis for those things so you feel better about it. And like we said last week, to replace fear with knowledge and hopefully give you a place where you can understand a place that who can you trust. So last week we talked about numbers. This week we're going to talk about all these precautions that they're asking us to do, which is a whole bunch. And do they really work? Are they effective? Are they going to keep me safe? And are they going to keep the people around me safe? So just as a reminder, flu season is normally October 1st through March 31st. And this has been a very odd year. We had seasonal flu and then COVID virus on top of it. So we haven't had a break. Usually in the summer we have a break. And in a month, seasonal flu is going to show back up again, and we're going to start having issues. And it is going to complicate the people that get COVID. If you have seasonal flu and COVID, it can really overload our hospital system. So there is a great concern for the second phase that's coming, the second wave that is coming, because seasonal flu is coming with it, as it always does. This is nothing new, and they're not trying to frighten us. They're just trying to be prepared. So we want to flatten the curve now, and that's why you've been asked to do all of these things that have been proven effective over the decades for healthcare providers to prevent patients and prevent you at all times. So flu vaccines are already out there. Some of the major pharmacies have got them, and you'll probably be hearing from your doctor soon to get vaccinated quickly as soon as it is available. The major medical, the doctors and the health systems do not have them yet because they get massive amounts of flu vaccines. But Vaughn's just announced yesterday, I saw the first ad. So I do know it's out there. My doctor had told me that this week. So they are going to try and encourage everyone to get a flu shot, a seasonal flu shot again this year, so that you are protected in one way against COVID, so you don't have to deal with two things. So back to the things they're asking us to do. They're kind of asking all of us to become nurses and doctors and healthcare providers. They're asking us to do the things that we know have worked for years, for decades, to protect patients from disease transmission between patient to patient, healthcare provider to patient, and patient to healthcare provider. So I'm going to talk about some of those things today and hope that you understand this is why they're actually asking us. They do work. It's actually, there's a reason behind it. So next week we will talk a lot about masks, but today I'm going to talk about the other things. So, standard medical practice for years has done standard precautions. You've probably heard that on the news, and you've also heard personal protective equipment. So we'll talk about what those things are and why we're limited. 30,000 masks a day in one facility is a lot of masks when you think about it. So are they effective? Like I said, hand hygiene, disinfecting, facial covering, social distancing, quarantine if you're sick, no commingling. Are these things effective? And these standards have been mandated in healthcare for many years. And all healthcare providers have to do these things to protect their patients. And it is a proven track record for disease prevention and transmission. I can't say that enough, to and from. So we do have the proof that this works. Hand washing is one of the first things that we've known for years. We know that when flu season comes along, all you hear all the time is on the news, everything, wash your hands, touch a door, wash your hands, wash your hands. So we do know that hand washing is the number one area to prevent transmission of infection. But we also use gloves and masks and gowns and goggles and face shields with known infections. We also actually isolate people when they are sick. So there's a reason for that. To prevent transmission of the infection from infection-free patients or people. So that's why these things are put in place. Someone that's infected, we do not want to give it to someone that is not infected. It is going to compromise their health. So we know they work. They've stood the test of time. So the Association for Professionals in Infection Control, APIC, was established in 1972 by a group of nurses, yay nurses, to standardize infection control practices in healthcare. APIC helped develop the hand washing technique that we do use now with the 20 seconds and the friction and all of that. This is the group of people. Now physicians and all medical people are part of this group, and they have gathered together to find out what works, what doesn't work. They've already done the work. They've already tried it. And we already know what works. So just wanted to encourage you that these things have been proven, tested, et cetera, and mandated now for all of us as healthcare providers. So it also established the personal protective equipment. So for us, that would be, for us healthcare professionals, that would be the mask and the gloves and the goggles and the face shield. We do use gowns when we need to, and I'll explain that, etc. So gloves basically keep things clean. They're not asking you to use gloves at this time, but they do suggest that if you are very immune compromised, that you might get some gloves and use them when you go out. But I try to encourage people. Unfortunately, sometimes when we use gloves, we have this false sense of security. So we still want to wash our hands. But places like the gas station, gloves is a really good idea. Throw them away before you get back in your car. And so when there's a risk of disease transmission is when gloves are used, whether it is disease transmission in your own body because you have a wound, you don't want to get it infected, or from one patient to another or one person to another. Gowns protect the clothing. That's basically what they do. And that is used in the hospitals to protect clothing, prevent things that are on the clothing that might contaminate somebody, and also prevent things being carried out of the rooms on people's clothing. Goggles, the only time that goggles are used are, you probably see it in surgery all the time. Goggles are used for splashing. So nobody's asking us to wear goggles because, the droplets are not splashing into our eyes. We're not at risk for that. Masks, as we well know, and face shields are now being recommended. And like I said, we'll talk a lot about those next week. What is good? What is bad? Does it work? Does it not work? Should we? Shouldn't we? Are we getting sick? Are we not getting sick? All of these things are related to masks. We're going to go to the experts, and we're going to actually talk about why using facial coverings is effective. So we'll spend an entire time just on that. Disinfection. I don't think I need to talk to you about this. We all know that we've learned since the 1918 Spanish flu how to disinfect, how to use hygiene, how to be careful. We clean our own homes, we clean our surfaces, etc. So asking us to disinfect our surfaces when somebody outside of the home has brought something in or you've brought something from outside makes total sense. We disinfect in between patients to prevent transmission of disease. So disinfection makes sense. It has been proven to work, and we all know that because we all do it on a regular basis. We're just now being asked to do it a little bit more than we did before. Isolation of ill family members. This is a standard practice that has been around for many, many years. School systems use this to screen children that have been ill with a fever before they come back to school. They have to be fever-free or symptom-free for a couple of days, fever-free for 24 hours or symptom-free for 2 days. And we've been using that for years. That is a recommendation by the public health officer that if someone is sick in your home, sequester them. It's called quarantining. We've been quarantining since the polio epidemic years ago. It is nothing new. It is a type of social distancing. So I want you to connect the dots. When someone is in the hospital with an infection, they are put in isolation, which is quarantine. They are put behind closed doors, and everyone that goes in and out has to be checked in, and they have to be gowned, gloved, masked, sometimes hats, sometimes foot coverings, etc., to protect themselves and protect the patient from further infection and to prevent taking that infection out of the room. We've learned to sequester people when they're in active infection. So this is why they're asking you, if you have an active infection, don't go anywhere. Stay at home, sequester into a room by yourself until you get well. This is good medical practice. This is good practice to prevent you and the rest of your family members. And don't have other people come into your house. Visitors should be limited. That's why they're asking us to stay at home. They're asking us to not increase our family group, only stay with our family group, those people that we're with all of the time. Because a new person being entered into that, I don't know if you've seen the ping pong ball example that they showed on their one person, and then ding, 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 ding. It does spread that way. So this is a good reason to stay at home unless you absolutely have to go out, and don't bring new people into your environment unless you absolutely have to. No parties, etc. And again, remember, this has been the standard of care since polio has been out there. This is nothing new. This is why social distancing in a different level is really good. We want to remove ourselves to some extent from people so we do not contaminate each other. So these are the things they're kind of asking us to do, and they do have proven history to work in the crisis situations in the hospital. So if they work in the crisis situations, they're going to work on the everyday level as well. I know some of them are hard. We're getting tired of washing our hands. We're getting tired of using masks. They itch our noses and they steam up our glasses and they do all of these things. However, we want to flatten this disease. We do not want it to spike in the fall. We want to get rid of it as much as possible as we're waiting on a vaccine, which is going to take quite a while to be out there before it can help anyone. And so we just want to be careful. And those are the things that they've encouraged us to be careful. And remember that they have said anyone over the age of 65 with any underlying diseases, we talked about those in the past, diabetes, asthma, any kind of lung disease, heart disease, immune compromised in any way, going through cancer treatment, all of those people, they are not going to lift the stay-at-home order for them until we're in phase 4, which means everything is opened back up. So stay at home and only go out for essential needs if you're in that category. And they announced this last week that over 50% of San Diego County is in that group. So that means two people of you in that house, one of you is going to be at risk. So it's higher than they thought. So we have a high population in the county of San Diego that are at risk already. So doing these things is really a good idea to flatten our curve. The numbers are starting to go down. Keep up the good work. So next week, we're going to talk about some other things that are out there in the media. What about deaths being attributed to COVID-19? Is this really as high as they're saying it's high? Like I said, next week, we're going to talk about cloth masks all by themselves and hopefully deal with the when it's good, when it's not, and what our public health department says about those things as well. So until next time, remember your actions save lives. San Diego has got a high population of older people with other diseases that can cause them to be at risk for COVID-19. Keep our communities healthy by staying in place, except for those essential needs, and wash your hands and keep your distance. Those are always good things anyway during the flu season. So I wanted to just end with, please wear your mask for the following 3 reasons. I saw this, I have posted it on my social media because it really touched my heart and it is how I feel. So I feel proud to say these things and hopefully it will help you. The 3 things to do regarding a mask is 1, humility. We don't know if we have COVID. It is clear that people can spread the disease without having any symptoms. That's been proven over the last 6 months. 2, kindness. We don't know if the person that we are near has a child battling cancer or cares for their elderly mom or is high at risk themselves. Again, 50% of our population. We might be fine, but they might not be. 3, community. We want our community to thrive, businesses to stay open, employees to be healthy. Keeping a lid on COVID helps us all in the long run. So until next time, you take care and God bless you.